So in this lecture, we'll talk about Brody's paper. And so firstly, um, this would be a paper on informed consent in primary care, where he proposes a fresh ethical and legal model, so the transparency standard. So Brody's central concern is that while the right to informed consent is legally and ethically accepted, its practice, especially in everyday primary care, is often ineffective, misunderstood, or simply ignored. So let's walk through the main points of Brody's argument. So Brody started his paper with a very, very sharp critique. So it was pretty intense. So he argues that informed consent has become bureaucratic legalism. So it's not a meaningful part of clinical care. So especially in primary care, doctors often see it as a box to check. So we're just conforming to the laws and avoiding liability. We are not actually having a conversation or shared decision making process. So why? Because current legal standards send the wrong message. So physicians worry more about avoiding lawsuits than about actually helping patients make informed decisions. So they fear that unless they list every possible risk, even obscure ones, they'll be held liable. So this is just now an activity of checking boxes and no one's hearing, no one is talking. So Brody critiques two main legal approaches. So the community practice standard says just do what other doctors do, and the problem is that it reinforces paternalism and ignores patient autonomy. And the second is the reasonable patient standard says tell the patient what a reasonable person would want to know. Well, this is better ethically, but in practice, it often translates into an overload of risk information that overwhelms patients and detaches from real decision making. Well, when that's too much, one, well, is too little. So, what should we do instead? So, Brody kind of proposes this new model. So this work kind of is inspired by Cass, so the last paper we read, and also he kind of builds on Cass' work here. So Brody takes inspiration from his idea. So he thinks that treat informed consent as a conversation and not as a legal checklist. So in this view, informed consent isn't about exhaustive disclosure. You don't have to tell patients everything. It's more about physicians and patients talking, listening, and thinking together. So it's relational, not transactional. But there is a catch. Conversation is hard to standardize. Courts need something more objective to evaluate legal disputes. And also, maybe in the medical institutions, we also have to, in a way, monitor and regulate our medical practices. If we are just all focused on conversations, that's very hard to monitor. That's very hard to, according to a standard, judge or evaluate. So, well, that's where Brody's own proposal comes in. So he kind of identifies something that Cass' model didn't do well at, and kind of gives his own proposal. So Brody proposes the transparency standard as a legally usable and ethically sound kind of half point or like a balance point. So this is how it works. So Brody argues that the physician meets the standard of informed consent when, one, they make their reasoning transparent. They explain why they're recommending a specific treatment or approach. Two, the patient is invited to ask questions, and those questions are answered respectfully and clearly. Three, the physician gauges how involved the patient wants to be and supports that level of involvement. So, in short, the doctor thinks out loud, and the patient has the right to listen, question, and respond, and they are invited to listen, question, and respond. And Brody argues that this approach works better in the realities of primary care because treatments are frequent but often low risk. So we have a lot of treatments on patients, but the risks normally are not that high. So patients are generally well enough to engage and to talk and to listen. Decisions unfold over time, so decisions are a process. It's not like one moment, it happens over time. So for instance, in terms of adjusting a medication, so if you think about if you've ever been to a psychiatrist, you might have experienced the process of going back to the doctors, like say every 2 weeks or every month, and we talk to the doctor about how we felt last week, and they adjust the medication. So that's like a decision unfolding over time. So Brody thinks that instead of dumping a list of risks on the patient, the doctor shares their clinical thought process. And they can talk about their thinking process, and if the patient wants more detail, they can ask. For physicians, the transparency model feels more natural and less legalistic, so it also alienates the doctors less. And also it encourages clear role, more intentional thinking. And it also offers a clear endpoint. So when the doctor has shared their thinking and responded to the patient's engagement, so that feels like a so much more clear endpoint. For the patients, it fosters more meaningful participation, it alienates them less, it clarifies what matters, not every possible risk, but how the doctor is thinking about the decision. Frequently, we might realize, surprisingly or not surprisingly, patients actually care more about how doctor is thinking about the decision rather than a list of potential risks. This also respects the patient's autonomy without assuming every patient wants the same level of involvement. And in legal terms, it allows courts to ask, did the physician disclose how they thought through the risks and benefits? So again, in terms of legal matters, we don't have the difficulty with standardizing. There is a clear, tangible standard or rule we can follow. And Brody was pretty hopeful comparing to Katz about informed consent here. He thinks that empirical studies are needed to see this would actually play out. So needed to see how this would actually play out. Still, like his model, so he feels like this research probably needs more development and empirical research. But this model aims to rehumanize the consent process by putting it within the ordinary doctor and patient relationship. It kind of make the doctors and patients less of legal subjects, but more as humans again. And he's also not claiming that this standard is perfect, but he believes it's a major improvement over whatever that's going on now, and he thinks there is less fear, less checklists, and he thinks that if we move towards that vision, it will be a much better system that we have now. There is also some discussion questions that I've prepared, so if you are interested, you can talk about them in the discussion post, and I'm also very happy to talk about these with you guys. So that's everything for this week's, and I hope you enjoyed all these, and see you next week.